What I can say now in general, I can't say for what's going to happen in 5 weeks from now. It's such an evolving virus, so things could be very different in a month from now. They could be more contained, or it could be continue to evolve as it has been. But what I say in general is that the statistic that really reassured me this week was that if you have contact with a positive patient with COVID-19, in the community, your risk of getting infected with that and presenting with symptoms, so having a symptomatic exposure, is 0.45%. So that's pretty low. If you live in the house with someone who's tested positive for COVID-19, you have about a 10% chance of developing a symptomatic infection. So to me, there's, the 0.45% is pretty low. Yes, when you're on an airplane, that I don't think they've studied the actual airplane. This is just some prelim data that's come out of China over the past month or two. They don't have all the data. There's probably a little higher than 0.45% if you're on an airplane. But again, just emphasizing good hand hygiene, not touching your face, all these things that we recommend to keep yourself healthy in general. What we think about is immune-compromised patients or patients with specific medical conditions make them at heightened risk of any infection. So during the flu season, patients with compromised immune systems, so if they're on chemotherapy for cancer, diabetes, chronic kidney disease on dialysis, chronic lung disease, they're at higher risk of getting respiratory infections in general. Asthma is a chronic lung disease, so they kind of fall in certain categories that we have a lower threshold to provide certain vaccines for. So I believe for PCV13, one of the pneumonia vaccines, if you have asthma and you're under the age of 65, you meet qualifications to receive that vaccine, because if you were to get a severe respiratory infection, your lungs may not be able to deal with it as well as if someone who had normal lungs.